Development cooperation in the health sector is of paramount importance because it serves a humanitarian purpose and it ensures people's health, which is the base for economic and social development in developing countries. In healthcare, JICA cooperates with developing countries in attaining universal health coverage under the framework of the SDGs. To this end, JICA's cooperation in Zambia's health sector has existed since 1980 and has mainly focused on maternal, newborn and child health, infectious disease control, HIV/AIDS, TB, and evidence-based planning and health system strengthening. Since the 1980s, JICA has contributed to improving maternal, newborn, and child health in Zambia through construction and medical equipment provisions at the Neonatal and Pediatric Surgical Center and the Department of Pediatrics and Child Health at UTH, cold chain capacity development for vaccinations, and many technical cooperation projects in Lusaka. Since the 2000s, JICA has also tackled infectious disease control, starting with HIV and TB response, and strengthened health system by both infrastructure and technical assistance. Infectious diseases are still the leading cause of high mortality rate in Zambia, and infrastructure such as hospitals and medical equipment are insufficient to deliver necessary health services, especially in highly populated areas. The purpose of the grant aid project for upgrading of Lusaka health centers to district hospitals, implemented in 2 phases, was to strengthen the existing facilities at Matero, Chilenje, Chawama, Kanyama and Chipata health centers and elevate them to district hospital level in order to improve healthcare access for residents of Lusaka while reducing the congestion at UTH and Levi Mwanawasa and reviving their function as the top referral and educational hospitals. The projects were implemented from July 2014 to January 2023, and all the 5 hospitals have since been handed over to the Ministry of Health.
Chenze chintu chovuta maningi kuchosa patient kumbukingira motoka taxi kumpeleka ku UTH chenze chintu chovuta maningi muziwa ndrama mwanezivutira but apa manje pano anamanga chipatala ichi at least apa manje ma UTH anachita monga yache panako at least titandizika kuchira paja kudala tenzovutika sikwenze chipatala chikulu manje apa ino nthawi tina chipatala chikulu. Look at me, I'm coming from the hospital instead of going to UTH manje na bwelo tengera mkwala wanga. So ndevi ntandizo amene tifuna mzambia yameneyi.
To complement the provision of hospital infrastructure and equipment, JICA has implemented a technical cooperation project to strengthen the hospital management capacity for the 5 hospitals since 2021. This project will strengthen their ability to improve problems based on monitoring, strengthening infection control, stock management of medicines and consumables that can be handled at the hospital level, and maintenance of facility equipment, strengthening cooperation among the 5 target hospitals. The project aims to strengthen the hospital operation management at the general hospitals in Lusaka.
Most of the work, particularly at primary health care level, here in Lusaka takes place in these hospitals that were built by JICA. We've had epidemics, as you know. We had the COVID-19 epidemic. We also had the cholera epidemic recently. And these hospitals, they also served as the place where we were taking care of our patients. I think you could attribute the recovery of most of our patients in some of these sub-districts largely to the presence of infrastructure by JICA. But this is not the only thing JICA has done. They have also conducted a lot of trainings, skills development, improvement of competences, infection prevention. So JICA has done a lot of work to build up our healthcare system in Lusaka.
In line with the government of the Republic of Zambia's universal health coverage and decentralization agenda, taking health services as close to the people as possible, JICA has embarked on the construction of 2 hospitals in Kitwe and Ndola, Copperbelt Province. By so doing, JICA has bridged the gap by constructing first-level hospitals to increase access to health services to the communities and decongesting teaching hospitals in Kitwe and Ndola respectively.
We used to go to the Kitwe Teaching Hospital, which is some kilometers away from Chamboli, just to have our mothers have their babies to deliver. And now that we are going to have that within our within Chamboli here, it is really going to help. And we are all happy and we are all excited, waiting and looking up to when that will come. It is like a dream that will come true.
We are very delighted with the support that we are getting from JICA and the Japanese government for the grant aid projects that have been undertaken that are being undertaken on the Copper Belt of upgrading these health centers to district hospitals. Obviously, it's an appropriate time that we are receiving these two facilities, the Chamboli Level 1 Hospital and Mushiri Level 1 Hospital, Chamboli in Kitwe and Mushiri in Ndola. So we know that this is obviously in line with the improving access to cost-effective healthcare services to our people, both in Kitwe and Ndola and just as a Copper Belt province as a whole.
The infrastructure will contribute to health system strengthening and enable the province to respond to national emergencies such as COVID-19 and cholera, among others.
The Japanese government constructed for the 5 hospitals as a grant aid, but it's hardware, so it means one day it will be decay. But how to bring the soul of the Japanese passion to the hospital is very important, because the JICA is more focused on the human development and also the importance of the technical cooperation. That in this meaning, the technical cooperation project is started, and for example, the medical superintendent is a doctor. For example, he is not manager initially, because of the university. In the university, they do not train as a manager. So that's why we'd like to we are conducting some technical cooperation project to support them to make the nice hospital.
A healthy nation is a productive nation, and it is fundamental in attaining sustainable development. JICA recognizes the need to adopt comprehensive, flexible, and multi-layered approaches to address the complex health challenges faced by developing countries. It is essential to consider a wide range of factors such as economic conditions, disease patterns, health service delivery, human and financial resources, and public administrative systems when laying out assistance policies and plans and putting them into practice. Aiming to help developing countries' self-reliance, JICA will focus on strengthening institutions' administrative capacity for implementation and management, managing health financing, improving the quality of health services, and strengthening workforce quality and quantity. In addition, JICA will work across sectors in areas such as infrastructure and water supply and sanitation systems, and also provide medical equipment and medicines where necessary to maximize the impact of its operations.